Good evening, everyone. At the outset, I would like to thank Global TV for giving me this opportunity to give a message on the World Hypertension Day. I am Dr. Srinivas Ramaka, consultant cardiologist, Srinivas Heart Center, and chairman, Srinivas Heart Foundation, Hanmakunda, Telangana. World Hypertension Day. Every year, 17th of May is considered as the World Hypertension Day. The call of the World Hypertension League, under which 80 organizations throughout the world work around to create awareness on silent killer of hypertension. World Hypertension Day is conducted every year on the call of the World Hypertension League. In the year 2005, the World Hypertension Day was held for the first time. 1.28 billion adults aged 30 to 79 years worldwide have hypertension. Most of these having hypertension, around two-thirds, are living in the low to middle income countries. Nearly 50% of adults with hypertension are unaware that they have this condition. And less than half of adults, around 42% with hypertension, are diagnosed and treated. That means only half of them are really diagnosed properly and treated for hypertension. 1 in 5 adults, that means around 21% of those with hypertension, have it under control. And hypertension is a major cause of premature death worldwide. The importance of hypertension is that as a target, the global target for non-communicable diseases is to reduce the prevalence of hypertension by 33% between 2010 to 2030. This is one of the global target for the Sustainable Development Goals. That means to reduce the prevalence of hypertension by 33% by 2030. Now, as I told you, for the first time in 2005, on the call of the World Hypertension League, the World Hypertension Day started. The World Hypertension Day basically aims to create awareness on the world population on the ill effects of hypertension and measures to control and prevent the complications secondary to hypertension. In 2005, the theme was creating awareness on hypertension. 2006, the theme of World Hypertension Day was preventing hypertension, treat to goal. And in 2007, the theme was healthy diet and healthy blood pressure. 2008, the theme was measure your blood pressure at home. The theme of World Hypertension Day 2024 is measure your blood pressure accurately, control it, and live longer. That means accurate measurements of blood pressure is very important, but control it and live longer. That means only if blood pressure is controlled properly, then the onset of complications like are prevented. Now in India, under this national program, particularly in the prevention of non-communicable diseases, it's a very wide program. Around 600 districts are covered in population screening of hypertension, with around 110 million people screened from June 2021. Now, this national program basically is as part of the WHO's technical package, what you call as the HEARTS technical package. Now, HEARTS technical package stands for adopting a healthy lifestyle counseling, evidence-based treatment protocols, proper evidence-based treatment protocols, creating access to essential medicines for a majority of the population, and risk-based management of hypertension, team-based care, and systems for monitoring. Now, ultimately, if a proper healthy lifestyle is adopted, An evidence-based treatment as per international guidelines given for management of hypertension and other risk factors, and entire population is provided easy access to essential medicines for management of cardiovascular disease and risk factors. And if there is a risk-based management, for example, based on cardiovascular risk like diabetes, hypertension, tobacco, family history, hyperlipidemia, and if the risk-based management is adopted, and if a team-based care is given, adopted, then the systems for monitoring are improved, then the implementation of the HEARTS technical package becomes successful in management of cardiovascular disease in particular. This is likely to reduce the premature mortality from non-communicable diseases by one-third by 2030, which is a sustainable development goal. Now, how do you measure blood pressure accurately? Normally, in routine clinic-based settings, we have to adopt a proper measurement of blood pressure because that is the basis for starting the treatment and preventing the onset of complications. Okay. Now we have various apparatus in the market, like we use a sigma manometer, the blood pressure measuring device. It could be an automated form or a semi-automated one. What we use, the mercury sigma manometer, is commonly used in routine clinical practice. What is ideal is a automated one. But if these automated equipment, the electronic apparatus devices are not validated and if they're not standardized, then there can be an erroneous readings of blood pressure, which is likely to be having a bad impact. Hence, it is important that there should be some validation of the automated equipment and semi-automated devices which we use in routine clinical practice. Stride Blood Pressure is an international scientific non-profit organization founded by the hypertension experts with the mission of improving the accuracy of blood pressure measurement in the diagnosis and management of hypertension globally. Validation of blood pressure measuring devices for accurate blood pressure measurement is quite important in routine clinical practice. Now, what are the causes of high blood pressure? What are the symptoms of hypertension? What are the complications of hypertension? And how do you prevent these complications? Now, blood pressure could be a primary hypertension or a secondary hypertension. Primary hypertension is what we see in routine clinical practice or the essential hypertension. It can be because of associated with old age, genetics, overweight, or obesity, physical inactivity, high intake of salt, and associated intake of too much alcohol. All these things can lead to a high blood pressure. Stress is one factor which can lead to a high blood pressure. Now, usually, a patient may have a very high blood pressure without any symptoms, but certain times he may have a severe headache. He may have, if there is an associated cardiac involvement, he may have associated cardiac symptoms like chest pain and effort intolerance or breathlessness, or could have giddiness. If there is a visual involvement in the form of a hypertensive retinopathy, he can have a visual defective vision or blurred vision. Sometimes there can be a high blood pressure. A patient may present with the nosebleeds or epistaxis. So, in all patients, primarily lifestyle management is quite important. Having a proper weight reduction, eating a healthy low salt diet, being physically active, and quitting tobacco and alcohol. Because these are the things which may impact a level of blood pressure. So, tobacco prevention, quitting tobacco, alcohol, avoiding alcohol totally, and weight maintenance, and adopting a healthy lifestyle, low salt diet management, all these will impact the management of blood pressure. And the WHO has given a fact sheet, basically a guideline on the pharmacological management of hypertension. Normal blood pressure being 120 by 80, anything between 120 by 80 to 140 by 90 is called as a pre-hypertension. Above 140 by 90, if the person has, then we need to treat it. For those with 140 by 90 when we give a treatment, it has to be lowered less than 140 by 90. Those with diabetes, those with cardiovascular disease, those with chronic kidney disease, and high risk for cardiovascular disease, the blood pressure goal should be less than 130 by 80. So, management of hypertension involves lifestyle modification, reducing stress, regular checkup of blood pressure, and can prevent the risk, reduce the risk by treating high blood pressure, managing the other medical conditions in presence of hypertension. The WHO report of 2023 says that 4 out of every 5 people with hypertension are not adequately treated. But if countries can scale the coverage, 76 million deaths could be avoided between 2023 and 2050. 1 in 3 adults worldwide are affected with hypertension, and this deadly condition may lead to stroke, acute myocardial infarction or a heart failure, chronic kidney disease, and many other health problems, particularly defective vision in the form of hypertensive retinal. Hence, hypertension being the silent killer, because sometimes the patient may have a very high blood pressure, but he may not have any symptoms, and even without symptoms also, he may have an onset of a or a presence of a significant disease in the form of retinopathy and cardiac involvement. So the WHO recommended plan for hypertension, which already told you earlier, it was the heart's technical package. Okay, protocol-based management of hypertension, medication and equipment supplied properly, team-based care, and patient-centered services, and having a proper information systems where a lot of patients with hypertension is entered, and periodic follow-up is done regularly. So, I'd like to tell all the viewers of Global TV that management of hypertension should be systematic. Blood pressure needs to be controlled regularly, and management of hypertension, both those with essential hypertension and those with secondary hypertension also. Secondary hypertension is a condition where the secondary causes are there, like patients with the kidney involvement, renal involvement, like chronic kidney disease, or sometimes the secondary causes like coarctation of aorta, which is a congenital disease where there is a clot in the aorta, and all these patients need to be managed correctly for preventing the onset of complications of hypertension. So once again, World Hypertension Day is conducted throughout the world to create awareness about the proper management of hypertension, prevent complications, and having a proper life and prolonging life. The theme of World Hypertension Day 2024 is measure blood pressure accurately, control the blood pressure so that the blood pressure is less than 140 by 90 normally. Those with diabetes, cardiovascular disease, and chronic kidney disease should be less than 130 by 80. And adopt a proper healthy lifestyle, use drugs correctly, so that the WHO's concept of arts technical package is implemented correctly, so that the blood pressure is controlled, and both the individual level, the population level, the morbidity and mortality from hypertension is reduced. Thank you so much, Global TV, and once again, my best wishes to all the viewers to have a healthy heart and a healthy life. Thank you so much.